Good evening and thanks for your time.
Thank you very much. Good evening, Ghana.
Now, first of all, walk us through how Eritrea recorded 100% recovery rates.
Well, Eritrea is very well known for its preventive measures throughout its health and other population-related issues and development. And in this case, there was a lot of political commitment, but more importantly, the non-health sector was what was activated at the time. And long before the COVID cases started to appear, there was a lot of community mobilization that was done. And they used the HIV and malaria modality that they had during the MDGs. As you know, Eritrea is the only country on the continent that had achieved 7 out of the 8 MDG goals. And that has also already created that infrastructure. For example, HIV came from 3.2% to 0.8% as we speak now. So they used those mechanisms, and also resource mobilization and allocation was also very effective because Eritrea has a very short governance structure in the country. It's not a very bureaucratic system. It has 6 regions, and the 6 regions are highly decentralized and do have services directly at the doorstep. And also there is a cash transfer program that has been going on for a long time that also now supported the social protection program that they set up for COVID using the same channel. So it was very easy to identify people who need food security and other services when during the lockdown time, and also to be able to reach people in their households. And also an early community mobilization activity in terms of IAC materials, information about COVID. Whatever was being said at the time was already being communicated to the community. So these are the very strong prevention approaches they had. And on the care front, like I said, they have very strong decentralized systems in Eritrea. And also there was an early preparedness also around February or so, March, early February. They already had a national preparedness plan for COVID response in place. And also they had pre-positioned a lot of PPE materials and trained the medics as well. Right. So also the early lockdown, which was both lockdown of the population in terms of movement and also closing the borders, was also done quite early. And compulsory quarantine for every passenger that comes, and also all COVID positive cases were taken to hospital for case management. Oh. And so these are some of the things that they did quite early in order to address the response.
Some will argue that declaring virus-free is not really a big deal, knowing that you can get an infection a day after you declare yourself virus-free. How would you react to this?
This is very interesting because, this pandemic is new to everybody, and everybody has their moments of mistakes, their moments of learning, and their moments of success. But to my understanding, Eritrea never declared itself a COVID-free country. All it did was it said we had 39 COVID cases, and all of them have recovered, and we have 0 deaths. But now what they have done is they said that they are now focusing on mass testing and also testing in urban areas and border areas, as well as the health professionals. So they are one step away from declaring a complete COVID-free status. But it's very interesting also, this is a double standard. For example, New Zealand declared itself COVID-free country, but nobody complained. So I guess when Africans succeed and arrive to this point, people have a lot of comments.
Would you say your population, a little over 5 million, also worked for the country?
I hear this narrative about population in this issue, and I really don't know how to even begin to think about it. Maybe in terms of organization, it may have some advantages. But remember, this is a pandemic, so it really cares less about the population, what big number or small number you have, because it is a pandemic. So therefore, it is the level of preparedness that the country puts in place. It's the level of prevention strategies that the country puts in place that matters in the end of the day. So the population, I don't know what role it may have helped, but in terms of organizing, mobilizing, and reaching out to the population, as compared to many other countries, it could probably be an advantage, but I really don't see the point.
All right. Before you go, you've worked here in Ghana before with the UN, and what do you think Ghana needs to do to get out of the woods?
Well, you see, it's like I said, this is a pandemic, so nobody really knows the formula of a perfect solution to everything. And also, societies and countries vary in terms of their social organizations and also institutions. For example, the kind of institutional arrangements we have in Ghana and in other places could vary. So Ghana, I think, has now really focused on mass testing. I think that is going to eventually give them that real picture of the pandemic in the country, and then they will just have to work backwards from there. So I can understand the challenge. I can also understand right now where all the debates are going. There is a lot of issue because a lot of people are thinking of fighting this pandemic through health care, and that is not really, that is the last measure, that's the last point of care, response. The primary response should be on prevention, and that prevention has to follow the structure of the community and the country and the governance structure as well.
Thank you very much for your time. I've been speaking to Kemi Haile. He is a former UN staff and a specialist in the Horn of Africa region.